mission is to make lives better for the Filipino. In more than 3 decades, the Philippine Council for Health Research and Development has invested in research and innovation, in people, in infrastructure, and in support systems to create an enabling environment for health research in the country, to generate innovations and solutions to our pressing health problems.
Created in 1982 as a sectoral council of the Department of Science and Technology, the PCHRD is mandated to coordinate all health research in the country. In 2013, the passage of Republic Act 10532, or the PNHRS law, further strengthened the PCHRD's leadership role in the Philippine National Health Research System as the national coordinating body for health research. The PCHRD has grown and expanded its services in the areas of agenda setting, research management, capacity building, research dissemination, translation and utilization, resource mobilization, and national and international collaborations. The Council, together with the Department of Health, the Commission on Higher Education, and the National Institutes of Health of UP Manila, sets the national agenda for health research. It does this by formulating the 6th-year National Unified Health Research Agenda, or NURA, which guides researchers who are seeking research funding. This national agenda-setting exercise was cited by the Council for Health Research and Development in Geneva as a model for low to middle-income countries in 2006. Within the NURA and the Harmonized National R&D Agenda, the Council supports collaborative research on drug discovery and development, omic technologies for health, functional foods, nutrition and food safety, dengue and other arboviruses, diagnostics, mental health, biomedical engineering and health technologies, information and communication technology for health, and disaster risk reduction and climate change adaptation for health. In other areas of the research agenda, the PCHRD teams up with the Department of Health in managing its health systems and policy research, and with the Philippine Health Insurance Corporation on healthcare financing. These partnerships augur well for the implementation of the Universal Health Care Act. The PCHRD promotes health research ethics as the country's commitment to the protection of the rights, welfare, and well-being of human participants in research. Together with the Philippine Health Research Ethics Board, or FRED, the highest policy-making body for ethical issues in human health research, the Council aims to strengthen institutional ethics review boards from registration to accreditation. Generated from the funded projects of the Council were important healthcare policies, products, and services. Even before the passage of the Technology Transfer Law of 2009, the Council already undertook technology commercialization, which seeded the growth of medicinal plant products in the country. Lagundi for cough and Sambonga's treatment for kidney stones are now household names. The Council's support for a dengue diagnostic kit led to the creation of the first startup company out of the UP system. Now the award-winning biotech M-Aqua kit is available in the market with sensitivity and specificity comparable to the standard test, but at a much lower cost. The Council's experience in technology transfer show the importance of the private sector as a partner. In 2012, the PCHRD was the first council that invested in a joint research with the industry through the Orthopedic International Incorporated. This joint research led to the Access Knee System for arthritis, which is now used by orthopedic surgeons for patients needing knee replacement in the country and soon in Asia. Built for Filipinos and other Asians, the Access Knee system costs 40 to 50% lower than what's currently in the market. With health innovations in the pipeline, the Council is, at the same time, building the capacity of research institutions and researchers to make sure that research projects are technology and industry ready. Research for evidence-informed policy making is an equally important path for our research outputs. Our supported researches contributed to the development of the expanded program on immunization, the Newborn Screening Act, the National Health Insurance Act, the Philippine National Health Research System Act, the National Integrated Cancer Control Act, and the Universal Healthcare Act. The PCHRD established the country's first online databases and information services through its Health Research and Development Information Network platform of Unified Research Information Management Systems, or HERDIN+. It is the only national health research repository containing more than 60,000 records. This resource is linked with the Western Pacific Region Index Medicus and subsequently the Global Index Medicus. The expertise that the Council developed in online databases allowed it to come up with a clinical trials registry with the Food and Drug Administration and an online project management system. To ensure that the country has a cadre of researchers who will undertake needed researches, the PCHRD provides scholarships, research fellowships, and other assistance for capacity building. The PCHRD is also developing a new crop of clinical researchers through our MD-PhD program and Masters in Molecular Medicine. The pioneering MD-PhD program is the only degree program in the Philippines that combines the features of MD and PhD courses in one, offering a unique opportunity for some of the best and aspiring young Filipino scientists to train for careers dedicated to the advancement of health through biomedical research. The Council's research fellowship programs are opportunities for collaborative R&D and capacity building for Filipino researchers through partnerships with leading research institutions worldwide. There are also incentives for young researchers to go into research careers. Likewise, recognition is given to mentors who share their expertise with beginning researchers. Equity in development. This is what PCHRD had in mind from its inception. In 1984, the first regional research consortium was formed. To date, each of the 17 regions has a research consortium, including the Bangsamoro Autonomous Region in Muslim Mindanao Health Research and Development Consortium. The idea is to capacitate each region towards self-determination in health research, thus increasing the country's research pool and research productivity. One feature of the regional consortia is the Regional Research Fund. This is a strategy of the Council to encourage new researchers to be actively involved in health research activities without having to compete with more experienced researchers. RRF projects are intended to build the capabilities of researchers in designing, implementing, and managing health research projects.
This is very consistent with our goal or our program of expanding our R&D base, our R&D pool, particularly spreading it across the country so that these research institutions located in various parts of the country can take up the challenge of addressing the needs in the region and also taking advantage of the opportunities that are available in the region.
Technology transcends nation-state borders. The Council sees integration of economic blocks, such as our own ASEAN, as one economic community. Over the years, the Council has slowly built its partnerships with international organizations and programs. Among these are ASEAN Network for Drugs, Diagnostics, Vaccines, and Traditional Medicines Innovation, the regional platform for collaborative R&D among the member states of ASEAN in collaboration with the World Health Organization TDR, the Special Program for Research and Training in Tropical Diseases, Newton Agham Program, E-Asia Joint Research Program, Southeast Asia-Europe Joint Funding Scheme for Research and Innovation, and ASEAN Science and Technology Innovation Fund. The Council also has partnerships with some of the world's leading research institutions, such as the United States National Institutes of Health, the London School of Hygiene and Tropical Medicine, Mayo Clinic, Harvard University, and Massachusetts General Hospital, among others. What sustains a health research system is communication. With this in mind, the Council maximizes the use of traditional and new media. Partnership is employed as a strategic approach. Partnership with media, partnership with the regional consortia's communication teams, and partnership with everyone who shares the Council's vision.
The DOS PCHRD is composed of professionals who are up to their game and know exactly what the country needs for the health sector.
Decades may have passed, but the PCHRD's mandate remains the same. PCHRD, making your life better.
This afternoon, may I request everyone to stand up for the singing of the Philippine National Anthem, to be followed by a short prayer. Good afternoon, ladies and gentlemen. Sa ating mga minamahal na kababayan dito sa Clark, Pampanga, mayap agat panapon. Isang mapagpalang hapon po sa ating lahat. We would also like to greet our virtual participants who are joining us via Facebook Live and via Zoom. Ayan, so we are not just live here, but also we are being streamed in Facebook and Zoom. All right? So maraming salamat po for joining us. On behalf of the Department of Science and Technology, Philippine Council for Health Research and Development, I welcome you all to this year's 3-minute pitch to policymakers competition. This event is part of the 15th PNHRS Week celebration with the theme Health Research, Responding to Challenges Towards National Recovery and Resiliency. Our event today is live, and as I have mentioned, it can also be accessed through the DOST PCHRD Facebook page and Zoom webinar. So tell your friends that we are also being live fed through Facebook Live so that they can also watch our event this afternoon. I am Dr. Giancarlo Malabad, an assistant scientist from the Department of Science and Technology, and I will be your competition master for today's event. All right, now it is my pleasure po to introduce the chair of the Research Utilization Committee of the Philippine National Health Research System to deliver her welcome remarks. She is the Deputy Director for Research Operations and a research professor at the Institute of Clinical Epidemiology at the UP Manila National Institutes of Health. She is also the Assistant Chair for Research at the Department of Surgery at the UP Philippine General Hospital. Ladies and gentlemen, let us all give a big round of applause to Dr. Marie Carmela Lapitan.
NIH Executive Director, my boss, Dr. Eva Cotiong Codela Paz, Department of Health, Health Policy Development and Planning Bureau Chief Health Program Officer, Mr. Theo Asuncion, National Economic Development Authority, Social Development Staff, Health, Nutrition and Population Division OIC Head, Mr. Tomasito Havate Jr., Philippine Heart Center Management Information Systems Division Chief, Dr. Pedro Sandiego Jr., our participants, virtual and face-to-face audience, ladies and gentlemen, again, good afternoon. It is my pleasure to welcome you all to this year's 3-minute pitch to policymakers competition held as part of the celebration of the 15th Philippine National Health Research System PNHRS Week. This initiative aims to cultivate the researchers' presentation and communication skills, and now more than ever, it is important that we elevate facts and credible science to inform policy, because we can take what we discover in our research and translate these findings into tangible actions and policies. While health research plays an integral role in strengthening health systems and ultimately achieving equity in global health, we at the PNHRS Research Utilization Committee believes that the most important benefit of health research lies in its utilization, translated into strategies, technologies, policies, and interventions that will make lives better for the Filipinos. To our participants, I would like to congratulate you for making it this far into the competition. Make your pitches this afternoon not only encourage policymakers to invest and promote evidence-informed policymaking for health, but most importantly, to inspire other researchers to take their research a step further into utilizing their studies for possible policy implications. I wish everyone good luck, and I highly encourage other researchers watching this afternoon to take inspiration from our participants so that you may hopefully join us next year and in the future 3-minute pitch competitions. Magandang hapon at mabuhay tayong lahat.
Maraming salamat po, Ma'am Mela, Dr. Lapitan. It's truly great to welcome everyone to our event this afternoon and see familiar faces and eventually have this face-to-face celebration or 3-minute pitch for policymakers competition after a few years that we have been doing this virtually. All right? Now, let me give you a brief background for the benefit of those who are not yet familiar with this competition. The main objective really of this activity is to cultivate the presentation and communication skills of our researchers. DOST PCHRD recognizes that research findings should be communicated to key policymakers and stakeholders to guide their decision making. And I know you couldn't agree more with that, right? Now, how did we select this year's finalists for this competition? We requested each Health Research and Development Consortium to nominate researchers with a PCHRD or consortium-funded health research project that has policy implications, all right? Then the nominees' research abstracts underwent preliminary screening to assess health policy implications. In this connection, we would like to acknowledge and thank our DOST Balik scientists, Dr. Rose Constantino, Dr. Raymond Sarmiento, Dr. Gerard Brian Gonzalez, and Dr. Heidi Cabanos for sharing their expertise with us during the preliminary screening of the nominees' research abstracts. Can we give them a round of applause, everyone? Maraming salamat po sa ating mga DOST Balik scientists. Now, as such, we are happy to announce that a total of 9 finalists or competitors passed the screening, and today they will deliver their policy pitches. The competitors should present their research with a one-slide presentation for a non-specialist audience that lasts no more than 3 minutes. That's why we have the 3-minute pitch, all right? Now, moving forward, it is my honor to introduce our esteemed panel of judges. The chair of our panel of judges, we have met her earlier, Dr. Marie Carmela Lapitan, the Deputy Director for Research Operations of UP-NIH. Ma'am, maraming salamat po ulit for serving as our panel head of our panel of judges. Can we check your mic, ma'am, if it's working?
Hello, everyone.
All right. Thank you po. Now, next, joining our distinguished panel is a professor of pediatrics and genetics, and presently, sabi nga ni Ma'am Mela, boss daw niya, no? So, the executive director of the UP Manila National Institutes of Health, Dr. Eva Cutronco de la Paz. Ma'am Eva, maraming salamat po for serving as one of our judges, and welcome to the competition. Can we check your mic, ma'am?
Magandang hapon po sa inyong lahat. Thank you.
All right. Thank you po, Ma'am Eva. Maraming salamat. Okay. Third in our list of the Board of Judges is currently the Chief Health Program Officer of the Health Research Division of the Health Policy Development and Planning Bureau of the Department of Health. He is a member secretary of the DOH Single Joint Research Ethics Board or SJREB. He is a nurse by profession, and he holds a master's degree in public health from the University of the Philippines, Manila, and a master's degree in health research ethics from the University of Malaya in Malaysia, which has a joint program with the Johns Hopkins University. Let's all give a warm round of applause to Sir Pio Justin Asuncion. Welcome po, Sir Pio. Can we check your mic if it's working, sir?
Hi everyone, good afternoon. Thank you.
All right, perfect. Maraming salamat po. The fourth member of our panel of judges is currently the OIC Chief Economic Development Specialist of the Health, Nutrition, and Population Division, Social Development Staff of the National Economic and Development Authority or NEDA, the country's premier socio-economic planning body. He holds a master's degree in development, evaluation, and management from the University of Antwerp in Belgium and a college degree in public administration from UP Diliman. He has been working with NEDA for 17 years now and with the Philippine government for 19 years already. Now it is my honor to welcome, as part of our panel of judges, Sir Tomasito Havate Jr. Welcome, sir. Can we check your mic po?
Magandang hapon po. Thank you.
Okay. Thank you, sir. Finally, to complete our panel of judges for this afternoon's competition, we have a cardiologist with a subspecialty in echocardiography. He is trained at the Philippine Heart Center and graduated in 2001. He obtained a Master's of Business Administration degree from the Ateneo Graduate School of Business. At present, he is the Chief of the Management Information Systems Division of the Philippine Heart Center. Ladies and gentlemen, let's all welcome Dr. Pedro San Diego Jr. Good afternoon po, sir, and welcome. Can we check your mic po?
Good afternoon, everyone.
All right, that's perfect. So there you have it. We have a very distinguished panel of judges that we have for this afternoon's competition. And our competitors are so blessed that you will be judged by this distinguished panel of judges. Are you excited to present your pitches? Walang atrasan na po ito, okay? And they are very excited also, for sure, to witness your presentation and see who's gonna win for this year's 3-minute pitch to policymakers competition. All right. Now at this point, I would like to to inform everyone about the rules and mechanics of the competition. Now we would like our competitors to strictly abide by the following rules. Okay, first, the time allotted to present the research project is strictly 3 minutes only. Okay, so that's prime. Should you exceed 3 minutes, you will have a 5-point deduction for every 1-minute extension, or that equates to a 1-point deduction for every 12 seconds of extension. Okay? An extension of less than 12 seconds will still be merit a 1-point deduction from your final score. All right? So I hope that is clear po sa ating mga competitors. Now, let me also add that after each presentation, our board of judges will be asking questions. So we will be having Q&A after each presentation. So to our board of judges, may I kindly request to please raise your hand after the presentation of our competitors for your questions. All right? And only a single and static PowerPoint slide is permitted to be presented. Slide transitions, animations, or movements of any description are not allowed, all right? So the slide is to be presented at the start of your pitch, all right? Now, we would not also allow electronic media such as sound and video files in your presentation, okay? There will be no additional props such as costumes, musical instruments, laboratory equipment that will be permitted. Okay? So, marami po tayong rules, no? Ayan. And strictly, no bringing and reading of script on stage. Alright? Competitors who appeared to be reading their script will incur a 2-point deduction in your final score. Okay? Presentations are to be in spoken word. So we don't expect you to be singing, to be rapping, and to be delivering via poems. Okay? And presentations are considered to have comments as soon as the competitor begins his or her presentation through movement or speech. Okay? And that's when the the time limit of 3 minutes will start. Okay? And when our board of judges have reached to their decision, that would be final. Okay? Now, let us go through the criteria for judging for this year's competition. The first criterion is for comprehension, and that would make 35% of the competitor's final score. And this criterion would include the ability of the presenter to provide understanding of the background and significance of the research, to deliver the impact and results of the research, and to present in a clear and logical sequence. Okay, so that's for comprehension criterion. Now, another 35% of your score will be for the communication style. And this would involve the use of appropriate language, avoiding scientific jargon, because we want it to be delivered to a non-specialist audience, right? And this would also involve your time allocation and your presentation to be as clear, legible, and concise as possible. Okay? And lastly, the last 30% of your score will be from the engagement criterion. And this would involve the ability of the presenter to make the audience more, to not to trivialize or generalize their research, and to convey enthusiasm for the research that they have done. Okay, so those criteria would make up 100% of the competitors' final scores. Okay, now next to the most exciting part, we have the prizes. Okay, syempre hindi naman po uuwi na bragging rights lang ang ating mga winners, no? We will be awarding and giving cash prizes to our competitors who will make it to the top 3. Okay, so the champion will receive 30,000 pesos. The second place will receive 20,000 pesos. The third place will receive 10,000 pesos. And we have a special award, the People's Choice Award, that will be based on audience votes. Okay, so for our audience here and nasa Facebook Live and Zoom, you have a say later on who will receive this People's Choice Award. So makinig po tayong lahat at bumoto tayo maya-maya. Okay? And the winner of this award will receive 5,000 pesos. O, di ba? So, boto po tayo. Okay? Mamaya, I will give the instructions for that. Alright? Now, are you all ready for our competition this afternoon? Yes? Okay, without further ado, let us begin the 3-minute pitch to Policymakers competition. Our first competitor is from the Ilocos region, Region 1. Ayan, we have Miss Marcia Abadilla Felizar, a registered psychologist from the Mariano Marcos Memorial Hospital and Medical Center. She will be presenting her policy pitch entitled Breaking the Silence, the Journey of Sexually Abused Children. Miss Felizar, have the floor now and you can present your pitch. Let's all give Ma'am Felizar a round of applause.
I am Marcia Abadilla Felizar, a psychologist, a mother of 2 boys, and a child advocate. I will be presenting to you Breaking the Silence, the Journey of Sexually Abused Children. While seeing children, we feel their joy, but learning that they were sexually abused, is it degrading? Is it deeply hurt? Indeed, it is a silent pandemic. The narratives, the personal narratives, and the lived experiences of the 38 sexually abused survivors clearly manifest feelings of anxiety, humiliation, and post-traumatic stress disorders. Most of them were in grades for not attaining the justice they deserve. In 2021, out of the 20 sexually abused filed in one court in Ilocos Norte, 11 cases were dismissed due to uncooperation, lack of interest to pursue the case, and settlement outside the court, or what we call arreglo. Only 2 cases were convicted. The perpetrators were convicted. One in every 5 children have experienced sexual violence. and in national data, there's an increase of 800 cases yearly. So is this the kind of environment or community we want our children to live in? Is there a gap that we need to address? There are laws, yes, but is it really implemented in the grassroots? Or is it the victim who is not really able to express their rights? Okay. So in here, you can see that this is all the data that coming from the sexually abused children. The impact of sexual abuse children, the impact of sexually abuse is devastating. It is real. So we need to stop it. We need to say stop. We need to stay enough. We need to say no more. Okay? So what then shall we do? We need a total collaboration from these agencies, from the DOH, the DOJ, the PNP, the DSWD, the LGU, and the DepEd. Ladies and gentlemen, the future of our children lay in our hands. So hopefully, this presentation will help us really to save and protect the welfare of our children. Thank you very much.
All right, maraming salamat po, Ma'am Marcia. Okay, so can we have our judges ask their questions? Sir, can you throw the first question po? Sir, Dr. San Pedro. Papa.
Good afternoon, ma'am.
Yes, po, Doc.
Thank you for your presentation. I think it was very concise, but I think what we were all looking for was, what is your ultimate goal? You mentioned several agencies.
Yes, po, Doc.
But you didn't give us a plan on what you intended to do. So I think what we want is actually, if we were policymakers,
yes, po, Doc.
what would your recommendation to us be? What is your plan?
Okay, so what was our plan right now, yes, Doc, is for us to have much more collaboration with each other, from the DOH. Can we present po the last slide? The slide po. The DOH, the DOJ, the DSWD, the PNP, the LGUs po, Doc, and the DepEd. So what we mean to say is, from the grassroots levels, may I share to you what is my experience, based on my experience. With this one po, from the DOH, DOJ, PNP, DSWD, LGU, and DepEd. Based on my experience, Doc, we need to strengthen and for them to have a collaboration, a deeper collaboration with each other. Because at times, if I testify in court po, Doc, usually there are no presence of a social worker accompanying the child during the court hearings. And even though when a PNP, during the interviews with the PNP, there are no social workers who are accompanying the child sexual abuse victims.
Okay. Do you have a follow-up question, sir?
No, okay. I'll leave it.
Ma'am Eva, the next question, please.
Thank you. Thank you po for your presentation. I think this is a very relevant topic. But you mentioned about collaborations, no? And I think I do agree with Dr. San Diego that we were waiting for you to give us like 3. I mean, collaboration is such a broad word.
Yes,
So maybe if you can just give to us, you did mention one form of collaboration, the presence of a social worker during the hearing. But can you tell us like 2 other things, like 3 big things that you think will be important for this collaboration to happen effectively for the cause that you are advocating for?
Okay. For this, thank you for that one, Dr. For the second one po, barangay is a small administrative level in our country. And since the victims came
from that small barangay, and usually the perpetrators are known or being loved or close by the victim. So what I'm also suggesting is that the reintegration of the child into that barangay in order for them to what we call the BC Barangay Council for Protection for Children, in order for them to have more access to the people that can help them. So like for instance, somebody there is being abused or being molested, then they can feel that there are some people in there who can be more affectionate and more affectionate and more compassionate and more being to help them and to assist them in giving more welfare to the children and protection. Thank you po. And another, you need put 3. Okay, right now, okay, with the help of our institution, the Mariano Marcos Hospital, who is very keen also in helping our province in Ilocos Norte. Then a while back, 2 weeks ago, we were talking with a family court judge because they really witnessed, the judge came from Manila, and they really witnessed that what they are practicing in Manila is not really seen in the provinces. So the BCPC, it's here in Manila. It's being practiced in Manila. To give you an example, like for instance, the child is asked to testify in court, but some of the court here in Manila, they will not be letting the child to testify in court. They are only videoed in order for them to not to be traumatized again with all the questions. So 2 weeks ago, I was able to meet a family judge lawyer, and then we were able to sit, they suggested that probably we can sit down together with the social workers, the PNP, the judiciary, in order for us to have better policies in the province. And hopefully our institution, the Mariano Marcos Memorial Hospital, will help us also to help the sexually abused survivors.
All right, can we have one more question? Sir Pio, go ahead with your question, sir.
First of all po, congratulations for your presentation.
Thank you po.
So, siguro my question, actually, the first time, the opening statement that you delivered earlier really captured my interest, no? And I think the case was strongly built. Although the question that I have po is, do you think the current data that you have, considering the premise of the study itself is around Mariana Marcos, if I'm not mistaken po, no? The respondents that you had with this study po, whether that particular data that you have in hand na would actually trigger or initiate discussion with the agencies, kasi there's a huge leap from an institution to the national scale na. So I think that would follow the question on the feasible options that you would offer later on. So would you mind po having some thoughts about that po? Over.
Yes, sir. In terms of the building policies into the region, then probably, sir, it's a stronger networking or linkages with the different agencies would be better in order for us to address whatever gaps is lacking. Thank you.
Okay, so that's it for our question and answer portion for Ma'am Marcia. Let's give her a warm round of applause. Thank you, Ma'am Marcia, for that pitch. All right, now moving forward from Ilocos, we will go to the Caraga region, and it will be represented by Sir Dines Carl Garcia, who is a nurse by profession. He is presently the Regional Adolescent Health and Development Program Manager, while at the same time, the team leader of the Health Systems Research Management Team of the DOH Center for Health Development, Caraga. His policy pitch entitled Making Health Work for Adolescents, is based on his research project, Reach and Quality of Adolescent Health and Development Services in Universal Healthcare Implementation Sites in Caraga region. Sir Dines, the floor is now yours for your pitch, sir. Let's give him a warm round of applause.
Good afternoon. I'm Dines Carl Garcia, a nurse from the Center for Health Development, Caraga, and presently the Regional Adolescent Health and Development Program Manager, and at the same time, the Research Unit Head. Adolescence is a stage of drastic physical and psychosocial changes. These changes range from the appearance of secondary sexual characteristics to changes in emotions, and is a very high time for risky behaviors and experimentation. For us to better understand our adolescents in the region, we randomly asked 392 of them, aged 10 to 19 years old, from the 3 UHC implementation sites in Caraga, Agusan del Sur, Surigao del Norte, and Butuan City, around June to July 2021, via online means. We came to understand that adolescents mainly get their information from their relatives and family members, with healthcare workers only coming second. 78%, or roughly 8 out of 10 adolescents, were not aware of and have not accessed adolescent-friendly services. Furthermore, access was dependent on the financial capacity of the family and the distance of the nearest health facility. However, those 20% who were able to access the services, they expressed that they felt welcome, that they felt safe, and there was no hindrance in services delivered. This entails that the low awareness of the health services or the adolescent-friendly health services prompts for intensified information, education, and communication strategies and interventions. And the low access can be addressed by establishing more adolescent-friendly health facilities in every level of government, from cities, municipalities, down to the barangay level. Also, this is high time, which I enjoin our local chief executives to support our adolescents by enacting policies that support, finance, and establish more adolescent-friendly health facilities in every level of the healthcare system. All of this to make health work for our adolescents. The 21% of the present population, but entails 100% of our future. Thank you.
All right, thank you very much. Very wonderful presentation, Sir Dines. Now can we have a question from our Board of Judges? Who will throw the first question to Sir Dines? Okay, Dr. San Diego, sir, your question, please.
Congratulations. You mentioned that you kept on mentioning health services, adolescent health services, but you did not mention any specific health, adolescent health service. So is your plan to actually get already those which are available, or to make your own? And can you specify or tell us which programs you intend to use or utilize with the other agencies? Thank you.
Thank you very much for that question, sir. Actually, at present, the DOH has the Adolescent Health and Development Program, which streamlines 12 component programs or 12 intervention programs such that they become adolescent-friendly, meaning they are fitted to the needs of adolescents. They range from nutrition counseling to HIV to STI and so on and so forth. There are 12 component programs. The primary direction of having an adolescent-friendly health facility is to make those existing programs friendly, welcoming, and safe, or to let adolescents feel safe when accessing. Because based on previous researches, adolescents do not or hesitate in accessing health services and health information from health facilities because of certain hindrances, which are eliminated by having a facility, existing facility, certified or assessed as an adolescent-friendly facility. So we need not reinvent the wheel. We streamline programs to become adolescent-friendly.
All right, thank you. Any follow-up questions, sir? No? Okay, any other questions from our Board of Judges? Okay, Ma'am Mela, can you throw the next question, please?
Yeah, thank you for that presentation. Very interesting. I'm just a bit surprised, well, not really surprised, but just wondering, because you said most of the information regarding these programs that reach the adolescents come through their families and then the health workers. But knowing the children now, adolescents most in particular, parang information gets to them. Do these things not get to them directly, like for example from social media? Did you pick that up in your research? And if ever, because like now, like most of these information programs or campaigns, I would think that would be directed to the younger generation, which should go more effectively through the social media. But it seems that this is not the finding of your research, and therefore with this, the recommendations that you've given, like more awareness, educational programs, should go through their families and the health workers rather than direct to these adolescents through, social media or other information communication means.
Okay, so the problem there is, if adolescents get their information, based on the study, adolescents get their information from their families and relatives. However, we want them to get the information from the health workers themselves to ensure quality and to ensure accuracy of health information. Because, yes ma'am.
Sorry, I think your study was about information regarding the availability of these adolescent health programs that should be available to them. Not health information, but rather the availability of these adolescent specific health programs.
Yes, actually what I meant in my presentation is that general health information comes from the family, but we want to advocate for them to get the information from our health workers, our adolescent-friendly, trained health workers, so that information would be more accurate and that it is from authorities regarding the subject matter.
All right, thank you. We can accommodate one more. Sir Tomasito, your question, please.
Thank you for your presentation. Just a follow-up question from the previous question on specifics on the assistance. You mentioned that for the health centers, you want them to have these services. What specific services were you trying to say? And on the health friendly institutions, what do you mean specifically when you have adolescent-friendly health facilities?
Okay. So to have an adolescent-friendly health facilities, number one is that there should be a physical room for adolescents to have their interaction with the health worker in private and in confidence. Number two, we need to train our service providers to be adolescent-friendly, or the strategies to give information. And those programs, those 12-component programs, from nutrition counseling, HIV, STI, substance abuse, and smoking, drugs and alcohol abuse, injury prevention, physical abuse and violence prevention, those component programs are already existing. What we need to do when we have, or when we want them to be adolescent-friendly, is for them to be delivered in a way that is more palatable or more acceptable to the perception of adolescents, such that they feel welcome, and again, based on the research, they feel welcome, they feel safe, and they feel comforted when they access such health programs. So the 12-component programs are already existing, just that we want them to be delivered in an adolescent-friendly health facility by a trained health worker, such that they become, those mainstream programs become adolescent-friendly.
All right, thank you so much, Sir Dines. How about a round of applause again for Sir Dines Carl Garcia? and from Caraga. And of course, maraming salamat din po sa ating Board of Judges who have raised their questions to our presenter. So Sir Dines, you may now join Ma'am Marcia to relax for now, okay, as we move on to our next competitor for this afternoon's competition. And we will be moving to the Davao region, Region 11, which will be represented by Dr. Elizabeth Malonzo, a professor at the Graduate School of the University of Mindanao, Davao City. She will present her policy pitch, Far Seeing Lives, Pampered PLHIV, based on her completed research project entitled Health Risk Behaviors and Adherence to Antiretroviral Therapy of People Living with HIV in Mindanao, Philippines. Let us all welcome Dr. Malonzo from Davao Region.
Good afternoon, everyone. Welcome to my presentation. As you can see on the screen, the title of my research is Health Risk Behaviors and Adherence to Antiretroviral Therapy Among People Living with HIV in Mindanao, Philippines, with a pitch title, Far Seeing Lives, Pampered PLHIV. The Philippines is still increasing in the number of cases of HIV/AIDS and is one of the countries in the world with low budget of HIV treatment. In my study, there were 13,855 who were HIV tested from 2016 to 2019. However, only 1,103 were tested positive. And out of that 1,103, only 1,049 availed of the free ART drugs given by the government. Simple systematic random sampling was used to choose the 322 participants of my study. The moderately high non-adherence of ART, almost 18% of my study, is a public health concern since it is a free ART program for life given by the government. RA 8504 formulates policies on HIV/AIDS, and one of these policies is establishing a comprehensive monitoring system. When will it be established? With the findings of my study of moderately high non-adherence of ART, this is my pitch to the health-related agencies of government to amend the existing laws to make it more responsive to the needs, to the changing needs of times. RA 8504 is often described as outdated 20-year-old legal framework which needs an urgent amendment. The health risk behaviors of the PLHIV are not a deterrent of the government's help for a free lifetime medication, although given the lowest budget. They are pampered because they are human beings needing help for a far-seeing life, which would significantly improve their chance of survival of being a person living with HIV. Thank you.
All right, a warm round of applause for Dr. Malonzo. Now it's time for our judges to throw their questions. Ma'am Eva, for the question, please.
Thank you. Maraming salamat po sa inyong presentation. I think, again, this is a very important public health problem that our country faces. Meron po akong importanteng question para po sa akin. Hindi ko po masyadong naintindihan kasi what pampered, HIV. What does it mean? Thank you.
Because of the health risk behaviors, government is still giving them free ART drugs, so they are pampered, although their health risk behaviors may be a factor of what they become PLHIV. So that's why I'm having the title of my pitch, Pampered. And far-seeing lives, we will see, because they're human beings, they need help, that they will survive. Their chance of survival will be greater if they will be given a chance for the government, because they have already free medication lifetime.
I just couldn't connect. I mean, you're saying that they need help, and at the same time, you're saying that they're, parang it has a negative connotation po kasi in a way.
Because, ma'am, what I'm trying to emphasize is the monitoring system. They are already given the treatment. The HIV/AIDS policies are prevention, treatment, and care. If you just treat them, there will be no care if there will be follow-up and monitoring of the patients.
And that's what you are proposing as part of, did I get it correctly? That's what you are proposing as part of the amendment of the law?
Yes, ma'am. Yes, Doc.
Okay po. Thank you po.
Thank you, Ma'am Eva. Other questions from our judges? Sir Pio, go ahead po.
First of all po, again, congratulations po for your presentation. Maybe just a rejoinder lang po of what Doc Eva has mentioned earlier. Maybe, I'm not that sure whether on your study you have identified some low-hanging fruits, because I think we're targeting na amendment to the laws. Meron po ba tayong na-identify na some policy options na would not entail that tedious amendment ng ating mga laws? Meron po bang some low-hanging fruits po na pwede nating bigyang focus for now to inform yung next move natin? Let's say, yan nga po, yung amendment of the laws po that you just mentioned.
Maybe in the monitoring system in Davao City, where I have studied the treatment hub, there is already an existing peer education program. So this peer education program would help other PLHIV, because the findings of my study, number one factor is forgetfulness. So they can monitor their peers not to forget getting the ARV drugs every time they have it ready.
All right. Thank you, ma'am. We can accommodate one more question from our Board of Judges. Do you have other questions? All right. So I think that's it. Thank you very much, Dr. Malonzo, for your 3-minute pitch. All right, I was checking our Facebook Live because we are being live fed there, and it's so encouraging that a lot of people are participating and they're cheering on their regional representatives. So just keep the cheers coming po sa ating mga virtual audience to boost the confidence of our competitors this afternoon. All right, so we are reading cheers from different regions po, no? They are rooting for their regional representatives. All right, maraming salamat po muli, Dr. Malonzo, and to our Board of Judges. Now let's proceed to the representative of the Cagayan Valley region, Region 2. Our competitor is a faculty member at the College of Allied Health Sciences of the Cagayan State University Andrews Campus. She will present her policy pitch, Unpreparedly Prepared, a turning point for Cagayan frontliners based on her research project entitled COVID-19 Knowledge of Frontliners in Cagayan, a cross-sectional study. Let's give a warm round of applause to Professor Jennifer Luyon. Ma'am, the floor is now yours for your presentation.
Imagine the time when the country is reeling for a pandemic brought by a disease that has claimed over 6 million lives globally for the past 2 years. And those who are in the front line of the battle have knowledge gaps on the disease signs and symptoms, modes of transmission, as well as its prevention and management. Our healthcare workers, at one point in their lives, were unprepared, yet have to be prepared to save and heal their patients. Our research examines the COVID-19 knowledge of Cagayan hospital and community-based frontliners. Cagayan was considered to be the epicenter of the pandemic in the northern Luzon. For the record, an average of 2,000 cases were reported daily. Unfortunately, a total of 1,961 deaths in the region have been attributed to COVID-19. Our research results show that in every 100 hospital-based frontliners surveyed, 47 of them were not able to attend trainings and seminars related to COVID-19, and that in every 100 randomly selected respondents, 13 of them have low level of knowledge on the disease clinical manifestations. Counterintuitively, community-based frontliners have significantly higher knowledge scores on disease signs and symptoms when compared to hospital-based frontliners. It turned out that community-based frontliners are teachable and are very knowledgeable when it comes to disease screening and monitoring. This could put the government at a vantage point of maximizing the potential of these smallest units of LGUs where intervention begins, utilizing maximal trained healthcare provider available at the community resource in order to deliver pre-hospital care assessment in order to reduce the risk of exposure, early detection and isolation, and prevent further transmission to a larger population. Along with the DOH strategy of using primary care, the healthcare provider network of LGUs can be maximized in order to improve the network and facility communication at the community level before they will be referred to hospitals. Furthermore, hospital-based frontliners who are the catch basin of COVID-19 patients with severe signs and symptoms may reconsider recalibration and reorientation on trainings and seminars related to COVID-19 and keep the pursuit of formulating the COVID-19 pathognomonic sign. Thank you so much for listening and good afternoon, everyone.
Thank you very much, Ma'am Jennifer. Now it's time for our judges to raise their questions to Professor Luyun. Any questions from our Board of Judges? Dr. San Diego, please.
Congratulations, ma'am.
Good afternoon.
Good afternoon. What I'd like maybe to hear from you is actually, what is your definition of frontliner? Because you mentioned that you wanted health education, but frontliner entails a lot of people, and I think some of them will not actually require the type of health education which I think you are trying to push.
In the scope of our study po, Doc, frontliners they are actually categorized into two, the hospital-based frontliners and the community-based frontliners. The hospital-based frontliners include those medical doctors who are actually at the quarantine facilities and those who are really treating and managing the COVID-19 patients, the nurses, the medical technologists, as well as the security guards that are assigned to the hospitals. On the other hand, the community-based frontliners are the members of the barangay health emergency response teams, as well as the barangay health workers, the municipal health officers po.
So with your plan is actually to have health-based education to include everyone.
Yes po.
Okay, thank you.
All right. Thank you, Dr. San Diego. Other questions from our Board of Judges? Okay. Sir Tomasito, go ahead po.
Thank you for the presentation. A very quick question lang. The objective is to determine the knowledge of the frontliners on COVID-19. I'd just like to know when was this undertaken, the study?
The study was undertaken last March 2021, March to May 2021 po. That was the time that there was really a surge of cases in the northern Luzon, particularly in Cagayan po.
All right. Thank you so much. Ma'am Eva, the last question, please, for this round.
Congratulations, Professor Leon. I wanted to ask whether before you ask your survey questions, it was a survey, right, that you administered?
Yes.
Did you also ask them whether they actually underwent some training before that time so that you were able to kind of catch those proportion of respondents who really had an opportunity to be trained?
Actually, it was part of our part one of our questionnaire where we asked them if by any chance they were able to attend trainings and seminars related to COVID-19. But it turned out that based on our surveys, especially for the hospital-based frontliners, if you are going to ask every 100 hospital-based frontliners, 47 of them were not able to attend trainings and seminars related to COVID-19. That's why they will always tell us based on our triangulation that they're really unprepared since they're not acquainted with how they're going to arrest the problem, and also they are confused with how they're going to do the referral system and the triaging because they did not have the trainings and seminars related to COVID-19. Unlike with the members of the Barangay Health Emergency Response Team, the MHO really implemented trainings and seminars related to COVID-19 for prevention purposes.
All right, thank you very much. A warm round of applause again to Ma'am Jennifer Luyun. And maraming salamat sa ating Board of Judges who have raised their questions. All right, 4 down. And we have 5 more to go for our competition this afternoon. Now let's go to our host region for this year's PNHRS Week celebration, the Central Luzon. Ayan, and the region will be represented by an adult disease specialist practicing in Cabanatuan City, Nueva Ecija. She is currently holding the position of Medical Officer 4 under the Department of Internal Medicine in Dr. Paulino J. Garcia Memorial Research and Medical Center. She will present her policy pitch, Kalinga para kay Lolo at Lola, the need for an accessible primary health care for the elderly. Let's all welcome Dr. Marjorie Nolasco. Ma'am, the floor is now yours for your pitch.
Aging is inevitable, and it is something that we should start preparing for. I am Dr. Marjorie Nolasco, an internist from Dr. PJG-MRMC, and my advocacy is elderly care. In the Philippines, the growth of the aging population is projected to increase to about 10% by 2025. As aging is commonly associated with age-related debilitating conditions and chronic diseases, the elderly will likely increase the demand for healthcare services. In a local study describing the characteristics of ER visits by older individuals in a tertiary hospital, diseases of the respiratory system, such as COPD and pneumonia, are the most common reasons for ER consultations. Majority of these visits were self-referral, meaning they prefer seeking ER consultations rather than a primary healthcare provider. And although majority of these visits were triaged as urgent cases, 73.7% of these patients were sent home after assessment and management. It implies that some of the cases can be managed in an outpatient care basis. Currently, the barangay health centers offer a program for the pregnant women and children under 5. However, there's no specific program or day which provides elderly outpatient care for acute and minor illnesses as well as the management of chronic conditions. This influences their health-seeking behavior, particularly avoiding seeking preventive, timely, and appropriate treatment, since many of whom cannot afford or do not have access to private outpatient care. Thus, the increase in the utilization of ER resources from self-referral consultations at a tertiary hospital happens. This led us to the conceptualization of the Kalinga para kay Lolo at Lola, the need for an accessible primary healthcare for the elderly. We recommend that the LGUs establish an elderly clinic in all barangay health centers with specific and dedicated day for them, and to disseminate healthcare-related campaigns to increase the healthcare literacy among the elderly. We also recommend the creation of a senior citizen tracking mechanism that would ensure that all senior citizens within their respective communities were accounted for with their regular healthcare and follow-up consultations. Furthermore, we recommend that the Department of Health mandate a program similar to the Under 5 clinic that would address the primary healthcare needs of the elderly. And lastly, we call upon the various medical societies, such as the Philippine College of Geriatric Medicine, to work in partnership with the DOH in capacitating our RHU physicians and primary healthcare providers in managing the common conditions of the elderly in the community. Our elders may be past their prime years, but like all of us, they still desire a life with good health, dignity, and a lot of love and care. So in our dream towards universal healthcare, let's leave no one behind. Let's now decide to give our elders the care they need and deserve. Thank you.
All right. Congratulations on making it on time for the 3-minute time limit. Okay. Congratulations. Thank you. And thank you, Dr. Nolasco. Can we have our judges throw their questions to Dr. Nolasco? Who will be the first to ask question from our Board of Judges? All right. Nako, mukhang... Okay, Ma'am Eva. Please po.
Congratulations, Dr. Nolasco. That was a great presentation. I wanted to ask, you actually presented very well. You gave the background as far as your research is concerned, and then what you would like to pitch for to policymakers. Are you aware of the programs that the DOH already have? I mean, you mentioned about under 5 programs, and you were alluding to having such a similar setup for the elderly, but are you aware of any programs that exist that you probably think is not sufficient, and that's why you're proposing for this primary care for the elderly? Thank you.
Yes, thank you, ma'am. So currently we have, under the Citizens Act, we have a program that mandates all the LGUs to create an Senior Citizens Affairs Office. However, these mostly cover for the discounts for the medicines and then for the laboratory examinations, which I think is insufficient for our elderlies in the community who needs help in their regular healthcare consultations. So mostly these patients do not have really enough financial means to have their regular laboratory exams, like regular consultations in hospital. So what they do is they go to a tertiary hospital, which provides them convenience in doing all these laboratory examinations, because most of the tertiary hospitals offer these laboratory exams and consultations for free. So if we have a barangay health center that is that could cater to these patients, that is similar to that of the under 5 clinic, because there is a specific day for children, there's a specific day for pregnant women, but we do not have specific day for elderly. So if we have those in our community, I think we can have a better response to the healthcare needs of our elderly. Thank you.
All right. Thank you, Dr. Nolasco. Other questions from our judges? All right. We have no more questions for Dr. Nolasco. Again, congratulations, Dr. Marjorie Nolasco from Region 3, Central Luzon. Okay, so we're more than halfway to our policy pitch competition, okay? So from our host region, we will now proceed. Eto po, kanina pa excited ang mga supporters ng Region 12 sa Facebook Live. And they've been waiting for the pitch presentation of our next presenter, okay? So Region 12, this is your time. You will be represented by a Doctor of Philosophy in Education and a research enthusiast whose advocacies are quality education and public health. She will present her policy pitch, Save the Mother, You Save the Child, We Save the Community, based on her research entitled Factors Affecting the High Prevalence Rate of Hepatitis B in Malapatan, Sarangani Province. Let us all give a warm round of applause to Dr. Benneth Mercado. Ma'am, the floor is now yours for the presentation.
Good afternoon, everyone. We were caught by surprise when COVID-19 hit us, and all our attentions were focused on addressing it. But researchers and the World Health Organization declared that there are other emerging diseases like hepatitis B that the world, including the Philippines, should also address. Dr. Gundo Weiler, the Western Pacific Director of WHO, presented in 2019 that many leaders are not well informed about hepatitis B, causing a 1.4 million deaths a year, increasing in the last 2 decades. And in the Philippines, he continued that hepatitis B is already a public health concern, with a case ratio of 1:10 people having chronic hepatitis B. In our region, Soc Sargent, in 2017, based on statistics, there were 220 cases, making us the third highest in the Philippines, and it is increasing. In 2020, from the Provincial Health Office of Sarangani, out of the 1,278 screened pregnant women, 69 were hepatitis B positive. It is really increasing, considering that it is only from one municipality, and we have 45 municipalities. Why is it increasing? Thus, we conducted research on the factors affecting the high prevalence rate of hepatitis B in a particular municipality in the region where cases are notably high. And the study revealed that the major factors affecting the high prevalence rate are low knowledge or absence of knowledge and understanding about hepatitis B and family transmission from mother to child. Health affects greatly the condition of people and the community. Community will not prosper if people are sick and dying. And there are so many opportunities lost because of the disease. Our 1987 Constitution, Article 2, Section 15 mandates that the state should protect and promote the health of people and instill its consciousness among them. So I urgently endorse that there should be a massive information drive about hepatitis B by declaring a National Hepatitis Day every July 28 in accordance with the World Hepatitis Day celebration, and a mandatory Hepa B screening among pregnant women, in which costs should be included in the maternal care package of PhilHealth, and vaccination and treatment for mothers should be given free by DOH. Save a mother, you save a child, we save a community. Thank you.
Thank you very much, Dr. Mercado. Okay, that was a very confident presentation. Now can we have our judges raise their questions to our competitor? Any questions po from our Board of Judges? All right, wala? Going once? Okay, Ma'am Mela, you ask po, ma'am.
You said that Hepa B screening for pregnant women is still not included as a package,
yet.
right? Would you know how much that would
In
cost?
our city, it's
Yes.
800
So,
Hepa B screening.
And how many pregnant women you think your municipality see, let's say, in a month?
I will just consider the population rate growth. No? If it is 10%, and then I would also assume that there will be 10% mothers who will be pregnant in the next. And that's the safest thing that I could project.
Yeah, because I guess, because that's a very concrete recommendation. Just put them in screening, make it free. Then probably to strengthen that pitch for that policy is you can say, it only costs this much to screen, but how much can we save in terms of, what the impact of getting all these hepatitis B transmission unleashed and uncontrolled. So yeah.
Because treatment is more costly than prevention.
Yeah.
Yes.
All right, Ma'am Eva.
Congratulations, Doctora. That was, I like your pitch of save a mother, save a child, save a community. So I wanted to ask, in Sorgsagen, what's the coverage for Hep B immunization from the newborn period?
Newborn, it's included in the Minchin.
Yes, it is.
Yes, within 24 hours from
Yes.
birth.
Yes.
Yes.
So are you able to do that like 100% of the
No.
births? Exactly.
Yes.
So, I mean, there's also one entry point, and that's really
Yes.
your vaccination. So, do you have any figures for that?
For the immunization?
Immunization.
There's already...
in particular, my question is, what's the percent of your newborns, how many actually get Hep B vaccination at birth? Because we know that's important, right? The at birth immunization.
Doc, it's not really included in our study. It does surface that it's due to the non-compliance of the Minchin. But if I go back to my reading, DOH presented that it's WHO, I think, and DOH, it's only 50% being implemented, the Minchin. That is why if I may continue to share, I read in the portal of DOH last week that they are going to have a rollout testing of children from 5 to 9 years old to evaluate the Minchin within the 25 provinces. So we have to look into it. So, but if it's too much to really pitch, I would really go for a HEPA-B Act, like the HIV Act, where prevention, treatment, monitoring, evaluation, and research should be included, including the specifics that I shared. If we could have a HEPA-B Act, it would be better, actually.
Thank you.
Thank you.
All right, how about a round of applause again to Dr. Mercado? Maraming salamat, Doc. And thank you to our Board of Judges. All right, so we're down to our last three. Meron na po ba kayong napupusuang iboboto mamaya? Okay, wag muna because we still have 3 more competitors for our competition this afternoon. All right? Moving forward, we will be watching the presentation of our representative from the Zamboanga region, Region 9. He is currently the head nurse of the Renal Center for Western Mindanao in Zamboanga City Medical Center. Today, he will present
$120 Filipinos per million population per year develop chronic kidney disease. 23,000 Filipinos today are undergoing dialysis, a treatment where it does the work of the kidneys by purifying the blood of waste and excess fluid. Dialysis patients need regular treatment, once a week, twice, thrice, some even daily. Imagine in these treatments, each patient has their own caregiver who may be blood-related or not, who may or may not receive monetary remuneration, yet takes care of them holistically. Among us Filipinos, the idea that caring for the sick is the responsibility of the children, and it is deeply rooted in the Filipino culture. If a family member, a relative, or a significant other becomes caregiver of the dialysis patient, then who takes care of the caregiver? Who looks after the welfare of the caregivers? And do these caregivers experience stress because of caregiving? In a journal written by Dr. Linda Pierce, caregivers are covert patients of the society. In my study, I tried to explore stress by finding out the presence of social constraint and physical exhaustion among caregivers of adult hemodialysis patients. Data shows that social constraint, physical exhaustion, and caregiving stress as a whole are perceived by 73% of the caregivers regardless of sex and age. And social constraint and physical exhaustion, they are correlated. To address this, we conducted focus group discussions, created caregiver support groups, and disseminated these findings in different national fora. But this is just a tiny speck in a universe of solutions and possibilities. As nurses, as professionals, as citizens, help us. Help us lobby policies through the Department of Health, appropriate agencies, and the Congress to integrate caregivers in the existing health and social welfare system. Arm our health districts and barangay health centers to cater caregivers' health needs in the community setting. Develop a national strategy to support caregivers. Provide training and education. Create opportunities for them. Incentivize qualified family caregivers. Because one day, it might be me. It might be you. It might be us who will be caregivers of our loved ones. And if this speech falls into deaf ears, then who will look after us? Thank you.
All right, what a presentation filled with conviction. Thank you so much, Sir Jozerk. Now, can we have our judges throw their questions to Sir Jozerk, to Sir Jay? Any questions, Sir Justin? Go ahead po, Sir Pio.
Hi, Jezerk. First of all, congratulations, no? very informative, straightforward, and I really like yung presentation na in one look of that slide, it provides all the needed information for you to communicate to us what you want to tell us. But from the policy options or recommendations that you just mentioned in there, would you mind ranking them kung ano ba yung dapat nating i-prioritize? That's the first question. And another one, can you expand further ano yung kinds of incentives, if ever na na-capture yun sa study mo, that you are recommending?
Yes, thank you. Let us start with the simplest, training. Training our barangay health workers, our PHNs, our doctors in the community setting. And second, we have to give incentives to our healthcare providers, not only in the community setting, but also in the hospitals. Like for example, dialysis patients' caregivers. They do help their dialysis patients. Actually, sir, in this pandemic, ang pinaka-affected ay ang dialysis patients. Why? Because if the caregivers get sick, automatically, hindi madadialyze si patient. Why? This dialysis patient call in sick, sorry sir, hindi po kami makakapasok. Kasi po, nagkasakit po si ganito, yung sinong magdadala sa amin. So let us help them. Incentivize. Another thing, we have to train them. And sana, meron din po tayong program for them to cater their health needs. Especially kahit may pa vitamins, may pa Zumba, just to do recreational activities for our caregivers para mawala naman din po yung stress nila. Thank you po.
All right, thank you. Dr. San Diego, your question, please.
Yes, Mr. Bial.
Yes po.
You mentioned that it was an awareness program. So I'd like to find out, can you be more specific because you mentioned Zumba. So I was actually not, I was in a quandary to actually which agency you are pointing at.
Yes, sir. Thank you for that. Actually, sir, I am pointing out for the DOH, DSWD, other private and public health sectors, and the mismong centers of the hemodialysis patients, because since my study is encapsulating the caregivers of the dialysis patients, let us start with where they are right now. The dialysis centers, the administrators, let us stop them. And eventually, in the long run, we can improve and touch the higher ups, such as the Congress, sir. Thank you.
All right, thank you. We can accommodate one more question from our judges. Do we have questions? Okay, so congratulations, Sir Joseph John. Let's give him a warm round of applause. And thank you po to our Board of Judges who asked their questions. All right, so we are now down to the last two presenters or competitors for our competition this afternoon. Without further ado, let me introduce the next competitor from Region 6. All right, the region will be represented by the head of the Public Information and Assistance Office and lead statistician of the Corazon Locsin Montelibano Memorial Regional Hospital in Bacolod City. He will present his policy pitch, P-Share, because we care. PhilHealth strategies for hospital administration and records efficiency, based on his research entitled Analysis on PhilHealth Process and its Effect on Outcome and Claims. Let us all welcome Sir John Michael Gabriel Zaragoza. Sir, the floor is now yours.
As a government hospital that mainly relies on PhilHealth reimbursement to maintain its services, how does CMRH maximizes its revenue through PhilHealth claims? During the first quarter of 2020, our medical center chief reported that our PhilHealth section has filed 39,000 PhilHealth claims. From this, 3% or 11 million pesos were denied claims and 11% or 55 million was returned to hospital claims. Curbing these financial losses could have helped a lot of hospital services such as inpatient care. Thus, understanding the problem led our group to conduct the study, the analysis of health process, and its effect on outcomes and claims. By reviewing 311 medical records and interviewing key people from the medical, nursing, billing records, and even from the PhilHealth Regional Office, we were able to come up with two main points. The first main point is that returned to hospital claims were due to incomplete patient records, which includes no history sheet, lacking laboratory results, no signature of doctors and nurses, which has an impact on the delaying process of the PhilHealth claims. Meanwhile, denied claims were due to patient data and diagnosis oversight, which includes the violation of the single-period confinement policy of PhilHealth. At the same time, we have exhausted benefits for more than 45 compensable days. Also, we have also non-compliance on the standard of care for the disease process. That's why we encourage our group to develop and conceptualize the PShare program. What is PShare program? That is the PhilHealth strategies on records, on hospital administration and records efficiency. Our program is an internet-based system that is embedded in our hospital information system that aims to monitor deficiencies, monitor our personnel responsible, and alerts them as a red flag mechanism to inform them that they have a deficiency that they need to address right there and then. That's why, with this development that we were able to create, we were able to improve the records management system by increasing the number of paper PhilHealth claims or paper movement, at the same time minimizing the deficiencies that incurred by our healthcare workers. Moreover, we have also inculcated the personal accountability of our personnel, wherein they are now more aware because they are informed by the system that they have something to do because it will be reflected in their performance evaluation system. And lastly, our program hopes to influence the attitude and behavior of the people, where we'll be able to inculcate transparency, responsibility, and accountability so that they will be able to go towards the path of good governance. Therefore, I ask my constituents here to take part on my journey, in my quest to have a higher revenue for hospitals, at the same time, how to have a better and healthier life for the Filipinos. Thank you.
All right, maraming salamat, Sir John Michael Gabriel. Okay, can we have our judges po to ask their questions for Sir John Michael Gabriel or Gabi? Okay, Dr. San Diego, please.
Yes, Mr. Zaragoza, I congratulate you on your work to try to increase PhilHealth claims. But I'd like to know more about the PShare program. Is it proprietary, open source? And if you move forward, do you have any plans of maybe sharing it with other hospitals?
Definitely, sir. That's the goal of our group, because we know that as a DOH-retained hospital, we do not have the sole, or we don't have a unique problem. It is a problem that is shared by many DOH-retained hospitals, even private hospitals. With this program, of course, we have to have our intellectual rights protected, we have to patent it, but we will also be able to share this as a DOH-funded research. We'll be able to share this with our DOH as our mother agency, so that it will be able to cascade this program to other DOH institutions.
All right, thank you. Other questions, Sir Pio?
Thank you very much and congratulations to your presentation. One quick question lang, kasi our direction in terms of the payment for claims it's more of front-loading na, not reimbursement. So I was just wondering if how the recommendations that you've just presented would actually inform that pa. So what do you think about that?
What do you mean, sir? See, our program, sir, the PhilHealth program, is actually a localized area wherein we were able to communicate with our fellow healthcare workers whenever they have incurred deficiency. Our goal of this program is actually to fast-track and minimize the turnaround time for the desired application for the PhilHealth claims to PhilHealth. So, in terms of trying to address them in a such way na yung sa PhilHealth, we'll be able to address more time with them early application, and then they will be able to communicate with us what are the problems that may have able to incur, so that we'll be able to refile them accordingly.
So with regard to the payment of claims kasi, hindi na siya yung through reimbursement. It's more of front-loading to facilities na yung payment via the institution would compute based on projected utilization of beds. And then instead of reimbursement, liquidation of the facility na lang yung i-require. So with that, ano yung magiging utility of your recommendation to that kind of mechanism?
Technically, sir, it would have much of the difference, whether it will be through that kind of the new system of the PhilHealth. What is important on our end is that we are able to control our own deficiencies in our institution, so that it will not lead to uncontrollable factors that the PhilHealth will be able to identify in their part. So I guess there's no much of the difference. It's just that we need to control our inputs, our things that we need to do in a hospital, so that we'll be able to, whether it is projected or liquidated, as long as it complies with the standards of PhilHealth.
All right. I think we have a question from Ma'am Mela. Ma'am Mela, go ahead po.
Thanks for that. Question lang, in your research, did you find, because you've identified areas where you can improve as far as you're concerned, as the hospital, as the health workers, how you manage your documents. But based on your study, is there an area where you could make recommendations to PhilHealth? This is how you can do your part better.
Yeah, actually, on our focus group discussion, part of which was we have an audience with the PhilHealth Regional Office. During that time, our attack with them is that as long as we're able to control our own deficiencies or our own controllable factors that causes delay on the PhilHealth process, we need to communicate and collaborate clearly with the regional office, so that we'll be able to address those deficiencies. Because actually, PhilHealth Regional Office in Region 6 has an open communication with our billing section. And by the time na makikita nila yung diferensya, they automatically communicate with us, so that they will be able to address accordingly. Hindi na kailangan na i-return pa siya sa hospital, and then, or hindi na kailangan i-deny pa.
So there's no workflow process on the PhilHealth side that can be improved based on the findings of your research.
For our information, wala po, ma'am, as far as I know. But then, actually, PhilHealth is willing to join our study for the phase 2, so that we'll be able to bridge that gap.
Okay, thank you po. Do we have other questions from our Board of Judges? All right, so let's give another round of applause to Sir John Michael Gabriel Zaragoza from Region 6. Okay, good job, sir, and thank you sa ating Board of Judges. Now, last but definitely not the least, eto na po ang hinihintay ng Region 4A, Calabarzon. Okay, let's hear it from Dr. Israel Ray Corpuz, who underwent residency training in clinical and anatomic pathology at the Batangas Medical Center from 2016 to 2020. He passed the anatomic pathology diplomate examination last December 2021. He will present this afternoon his policy pitch entitled High Risk of Bacterial Contamination of Blood for Transfusion, based on his research project, Incidence of Bacterial Contamination of Packed Red Blood Cell Units in Batangas Medical Center. Let us all welcome to the stage Dr. Israel Ray Corpuz. Doc, you may now start with your pitch.
Good afternoon. I'm Dr. Israel Corpus, a pathologist from Batangas Medical Center. My advocacy is to reduce unsafe blood transfusion and improve patient outcome. Blood transfusion can be a life-saving procedure. Thus, it must be safe and must be done after thorough assessment. However, blood products can be contaminated with viruses, bacteria, or parasites, which can be directly infused into the bloodstream, causing infection. With the advancement of viral detection, bacteria have become the most common source of sickness and death of transfusion-associated infection. Bacterial contamination commonly occurs during blood collection due to inadequate skin disinfection. With this, the most common isolated bacteria are normally found from the skin. Being one of the largest blood bank facilities in our region, we conducted a study to determine the incidence of bacterial contamination in packed red blood cell units. Over a 2-month period, 16 out of 173 units were found positive for bacterial contamination. Most of the isolates are of the skin flora, like Staphylococcus epidermidis. The incidence rate of 9.25% is similar to other developing countries, but higher compared to developed countries who only average 0.1 to 0.2%. Knowing the incidence and source of bacterial contamination will help reduce the transfusion-associated infections. One study identified 6 aspects to reduce the bacterial contamination in the transfusion chain, namely donor eligibility, adequate skin disinfection, optimal blood handling, usage of diversion pouch, bacterial detection, and pathogen reduction method. This will guide our blood transfusion practices, policies, and education. With this, we should formulate, strengthen, and update our policies. Formulate policy that will ensure blood integrity and safety. Strengthen our policies through strict supervision, implementation, and evaluation. And lastly, update our policies through research that we may be able to innovate our practices toward a safer blood transfusion. We must address this with seriousness and urgency to prevent any untoward complications of blood transfusion. Thank you and God bless.
All right, maraming salamat, Dr. Corpus. Now it's time for our judges to ask their questions for Dr. Corpus. Do we have one po? Dr. San Diego, please.
Good afternoon, Dr. Corpus. It's on. When you were, your study was of one hospital.
Yes, po.
Okay. And when you mentioned the integrity of blood products, when you counted them out, it seems like there were already programs for them. They were already being done already. So what type of programs are you planning aside from that? Because those are plans already being done.
Yes, po.
What plans or what different plans do you intend to implement when you go to the national level?
Yes, po. First, I think I will focus first on the bacterial detection because we will not know the status of our bacterial contamination if we do not know the incidence of bacterial contamination of each blood facilities. I think the next, I think we should focus regarding on the optimal blood handling, especially the cold chain from collection to maintain the cold chain of our blood bags. Then next, I think usage of the diversion pouch. I know diversion pouch is additional cost in our blood banks because I think it's mahal, diversion pouch. But I think it will help to lessen the bacterial contamination because the first 15 to 30 ml of blood contains most of the skin contaminants. That's why this diversion pouch will lessen the risk of contamination.
All right. Any other question, Ma'am Eva po?
Congratulations, Dr. Corpus. Based on the recommendations that you mentioned in your 3-minute pitch, whom do you think will be your best policymakers where you would do this pitch?
Okay po. I think it is best for the, I think not just only the blood bank staff, but also other clinicians who orders, I think, blood. And also they can conduct studies regarding the clinical correlation aspects in this problem regarding bacterial transfusion, bacterial contamination. Because bacterial contamination is just only the tip of the iceberg. It is the clinical complication that is important. And we should, I think, conduct studies regarding it so that we may know the whole picture of bacterial contamination.
Thank you.
All right. Any other questions po from our judges? Okay, if none, congratulations, Dr. Corpus, and thank you for your presentation. And thank you din po sa ating Board of Judges. So there you have them, our final 9 for this year's 3-minute pitch to policymakers competition. Let's all give them a loud round of applause, everyone. Okay, good job. What excellent pitches you have presented ngayong hapon na ito, representing a broad range of very interesting and relevant research topics with several implications for health policy. And we hope that it doesn't end here, but it will move forward to really experiencing the policy that will be coming out from these research projects that our finalists have presented. All right, now it's time for our judges to have their deliberation. So they have the very difficult job of selecting our top 3 winners for this year's competition. So we would like to request our secretariat to escort and lead our judges to a VIP lounge at this side po. Ma'am May will be escorting po and leading you to the VIP lounge. And give a round of applause, of course, to all our judges as well. Maraming salamat po. Now, while our judges are being escorted, okay, sa ating VIP lounge, our live and virtual audience, you in Facebook Live, in Zoom, and here in Marriott Hotel, you have the opportunity to vote for your favorite competitor. And I hope we will be very objective with this, okay? Now, to access the poll via Google Form, please open a browser and scan the QR code or type the link in your search bar. The poll, for our Zoom participants, you will also be able to get the link in the chat box, and to our Facebook Live participants, you will have the link in the Facebook comment section, okay? And guess how long we will be giving you for the vote? Any guess? You will only have 3 minutes also to vote, okay? So bilisan po natin ang pagboto sa ating favorite competitor, okay? Para po manalo ng People's Choice Award for this year, all right? Now, of course, we will be basing our judgment on the presented criteria earlier. Okay, so who among our competitors delivered the best policy pitch? Choose one only. Okay, so cast your vote. Your 3 minutes starts now. Okay, hands on your devices. Ayan. So just a reminder, the People's Choice Award recipient will be given 5,000 pesos in cash. Okay? Ayan, so naipost na po natin sa Facebook at sa Zoom. I know you are very proud of your regional representatives. I must say they're very excellent pictures, no, sa ating competition ngayong hapon. But like all other competitions, we will only award the top 3 plus the People's Choice Award. Okay, 2 minutes left. Ayan, yung iba nakaboto na, no? All right, halfway there. Take your time. 1 minute and 30 seconds. Vote wisely, okay? Vote wisely. And objectively, of course. All right, 50 seconds left. Okay, nakaboto na po ba? 30 seconds left. Ten, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay, time's up. That's all that we have for our People's Choice Award voting. Okay? All right. So, as our poll has just ended, the winner for the People's Choice Award will be presented later with the announcement of our winners. Maraming salamat po to all our virtual and in-person audience who casted their votes for their favorite competitors ngayong hapon. To give our judges enough time to deliberate, kasi alam po natin napakahirap ng kanilang trabaho ngayong hapon, we will be having a 15-minute break. Okay? In the meantime po, please be oriented on the PCHRD services through the videos that will be flashed on screen. All right? So we'll see you in 15 minutes.
Gumanda ang buhay ng Pinoy. Yan ang layunin ng Philippine Council for Health Research and Development. Sangay ng DOST na katuwang ng mga Pinoy researcher, dama natin ang PCHRD sa mga tuhod na may bagong lakas ng Axis Knee System, sa herbal na gamot at supplement na nagpapabuti ng kalusugan, at test kits na gawang Pinoy, kaya naging abot kaya.
Patuloy ang research, patuloy ang suporta, patuloy ang PCHRD.
For the very first time, in March 2023, the Philippine Council for Health Research and Development, PCHRD, will recognize outstanding individuals and institutions who became part of its journey in making Filipino lives better through health research and development. In the biggest health research event, the PCHRD Heart Awards, Outstanding Technical Evaluator Award recognizes the outstanding and invaluable contribution of technical evaluators in providing technical and expert advice and recommendations needed by the PCHRD during appraisal of proposals until the closing of projects. Outstanding Technical Working Group. This award is given to an assembly of experts who strongly work together in developing procedures and other significant activities necessary for the research program area to meet a specific objective. Outstanding Technical Advisory Group. This award is given to the Technical Advisory Group who provided invaluable contributions in effectively guiding the Council in accomplishing the objectives and deliverables of its various programs towards the achievement of its vision. Outstanding Health Research and Development Consortium Award. This award is given to the Outstanding Regional Health Research and Development Consortium in recognition of its remarkable commitment, efforts, and accomplishments in transforming the regional health research community through health R&D. Consistent coverage of Balakayang Heartbeat. The award will recognize media partners who constantly participate in the Council's press conferences and are able to publish news releases and other publications about PCHRD. Outstanding Communicator in Health Research. The award will recognize media partners who helped us bridge the gap, making PCHRD-related health research information and technical details relatable to the general public. Media Institution of the Year. The award will be given to the media institution who featured the most number of publications, news releases, interviews, and videos combined related to PCHRD and its supported projects and initiatives. The winners will be awarded this trophy, designed by the famous sculptor, Mr. Juan Sajid Imao. The trophy symbolizes the continuing commitment and the collective effort to address healthcare burdens and promote better health for the Filipino people. It shows how solidarity and cooperation in health research can help achieve our mission of making lives better. A symbol of Filipinos, uplifting Filipinos.
If you are a part of higher education institution or research and development institution, a researcher, a research manager, a student, or an individual in need of health research information, then Herdin Plus is for you. The Health Research and Development Information Network Platform of Unified Research Information Management Systems, or Herdin Plus, is an online health research information management system. Developed and managed by the Department of Science and Technology, Philippine Council for Health Research and Development. For health research generating institution, with Herdin Plus, you can manage health and health-related research information for free, disseminate health and health-related research to a wider audience, and generate comprehensive reports to help evaluate your institutional research performance. For individuals, researchers, or students in need of health and health-related research information, you may access Filipiniana Health and Health-related studies for free. Visit herdin.ph, your one-stop health research information management platform.
Over the years, the medical community has come to realize that improvement in healthcare could not be possible with only patient management and clinical care. By bridging the gap between healthcare practices and new developments in research, progress in the country is imminent. It is with this purpose that the sole and pioneering MD PhD in Molecular Medicine program was birthed.
The program aims to improve the Philippine healthcare standard through research by producing a hybrid class of doctors, the physician scientists. It is envisioned that a medical doctor with a strong background in basic and clinical research is a more effective professional who can keep up and also contribute to the progress of the different fields of medicine.
The UP Board of Regents approved the program in 1999 and through partnership with the Department of Science and Technology and the Philippine Council for Health Research and Development, the first batch of DOST MD-PhD scholars was welcomed in 2010. DOST PCHRD offers full scholarship to the students through their 8-year program, which is composed of 5-year medicine courses and 3 years of PhD units.
The program envisions to produce graduates who will spearhead basic and biomedical researches, generating innovative ideas in the different fields with relevant impact on national development.
Admission to the program is done by selecting from the pool of qualifiers to the UP College of Medicine. Candidates for interview are evaluated with the following criteria: graduates from a biomedical field, preferably in biochemistry, molecular biology, or biotechnology, with a general weighted average of at least 1.75, and students with high aptitude and motivation for advanced study in molecular medicine and related areas in the health sciences.
The MD-PhD Molecular Medicine curriculum trains students in the field of biochemistry and molecular biology, medical microbiology, and medical parasitology. Said fields comprise the core courses, which also include epidemiology and biostatistics. These PhD courses are taken in the first year of the program. To have a
that ends our break. It didn't take long for our judges to select and we would like to inform our finalists that our judges are very much appreciative and they are very proud of all your wonderful presentations and pitches, very promising presentations, and we hope that it will have really policy implications that we can see in the near future. Muli po, isang masigabong palakpakan para sa ating mga finalists for this year's 3-minute pitch to policymakers competition. So like any other competition, we just have to select top 3. But having been selected as the final 9 is already a big achievement to all of you. So congratulations po sa inyong lahat. Alright? Ayan, excited na ang lahat ng ating participants to know who will be this year's winners for the 3-minute pitch to policymakers competition. Okay? Pero bago po tayo dumako dyan, ay una muna nating pasasalamatan at i-appreciate ang ating very dedicated board of judges ngayong hapon na ito. So I would like to call on our board of judges to please join me here on stage po for the picture taking and the awarding of certificates. Ayan, sige po. Dr. Lapitan, Dr. Cuchonco de la Paz, Sir Justin Pio Asuncion, Sir Tomasito Habate Jr., and Dr. Pedro San Diego. Please join me here po. And I would like to read the certificate for our dedicated board of judges. Okay, can we flash the certificates po? Okay, so let me read. The Philippine National Health Research System and the Central Luzon Health Research and Development Consortium present this certificate of appreciation to our Board of Judges for their invaluable contribution as judges in the 3-minute pitch to policymakers competition during the 15th PNHRS Week celebration held on August 10, 2022, given this 10th day of August 2022 at Clark Marriott Hotel, Clark Freeport Zone, Mabalacat, Pampanga. Signed by the Executive Director of DOST PCHRD and the Lead Coordinator of PNHRS, Dr. Jaime C. Montoya, and the Regional Director of DOST Region 3 and the Chair of the CLHRDC, Dr. Julius Cesar Sicat. We now present the Certificate of Appreciation to Dr. Eva Maria Cutionco de la Paz. Also to Sir Pio Justin V. Asuncion. Also to Sir Tomasito P. Habate Jr. To Dr. Pedro P. San Diego Jr. And to the chair of our panel of judges, Dr. Marie Carmela M. Lapitan. Okay, let's have a picture taking po. Another round of applause to our Board of Judges. Maraming salamat po. Now we will have the most exciting part of our competition, and that's none other than the announcement of winners, the third place, the second place, the champion, and the People's Choice Awardee. Did you know we are very encouraged by the participation of our virtual audience and even our in-person audience, because more than 1,000 have casted their votes for this year's People's Choice Award. Maraming salamat po for casting your vote. Ayan, sino kaya ang People's Choice sa ating competition ngayong taon na ito. So I will now call on Dr. Mela Lapitan to announce our winners of this year's competition.
Thank you, JC. Okay, so we will be announcing 4 winners today. So let's start with the People's Choice Award. So the People's Choice Award is given to the competitor who garnered the highest number of audience votes from the Google form that we showed, and the awardee will receive a big check worth 5,000 pesos. So this year's recipient of the 3-minute pitch to Policymakers competition's People's Choice Award is, drum roll, Mr. John Michael Gabriel Zaragoza of Region 6 for the policy pitch entitled We Share Because We Share, PHIC Strategies for Hospital Administration and Records Efficiency. Congratulations! Now,
all right, we want to enjoin the colleagues of our People's Choice Awardee to join on the stage for the picture taking. It was a team effort. Congratulations. From Corazon Locsin Montelibano Memorial Regional Hospital in Bacolod City. Okay, another round of applause. And wag po kayong mag-alala, ang ating other 8 finalists, kayo ay People's Choice Awardee ng inyong mga respective regions. Okay?
for transparency, we will flash the results of the poll through your screen, for the screens there. These are the top 5 competitors based on the poll.
It was a landslide victory.
Okay. All right, so let's move on. Now, for the 3rd place, the competitor who secured the 3rd place and received the same size but check worth more, 10,000 pesos with an average score of 88.6. Pakinggan nyo maigi, 88.6 kasi malapit siya sa 2nd place. So the 3rd place goes to Dr. Beneth Mercado of Region 12 for the policy pitch entitled Addressing the Prevalence of Hepatitis B Among Pregnant Women, Reducing Its Impact. Save a mother, save a baby, save a community. That's what I remember. Congratulations! Okay, for the 2nd place, the competitor who landed 2nd place is awarded, wow, 20,000 pesos. Ma'am, may tax po nakasama. Sige, 20 lang dito sa script ko eh. 25 less tax garnering a total score of 89 points. The second place goes to Miss Jennifer Luyon of Region 2 for the policy pitch entitled Unpreparedly Prepared, a Turning Point for Cagayan Frontliners. Congratulations! Congratulations! Alright. Okay, for the champion. The champion will receive, ano ba nakasulat dyan? Written here, 37,500, less tax, 30,000 pesos, with a score of 93.6. This year's 3-minute pitch to Policymakers competitors champion is Dr. Marjorie Nolasco of Region 3 for the policy pitch entitled Kalinga para kay Lolo at Lola, the need for an accessible primary health care for the elderly. Congratulations!
Alright, maraming salamat to our Board of Judges. Okay.
No, I had to pull JC back because there's something that all the judges wanted to make sure that everybody hears. We really had a hard time judging, well, because we had to choose 3. But we want to tell all the competitors here that we really love all your pitches, and we know that in all your researches, everything that you've put in, showed us today, there's something there that we can pitch to all the policymakers here. So I hope this competition doesn't stop you from moving all your pitches forward and really transforming your research into policy programs and whatever. So please carry on, and thank you very much for all the work that you do. And we also want, the judges also want to thank, of course, the Research to Policy team headed by Yuli Garcia, Joanne Hernandez, Paula De Leon, Catherine Di Mailig, Giselle Bigay, and of course, JC here. So thank you and congratulations to everyone.
Maraming salamat po, Ma'am Mela, and to our Board of Judges. So, sa Kongreso po ang tuloy natin. Okay, hindi natatapos dito ang laban. Okay, maraming salamat. Thank you very much to our competitors for joining this year's competition, and congratulations to all of you. Hindi nyo po iuwi ang mga malalaking cheque na yan, okay? Gagamitin po natin yan next year, okay? But DOST PCHRD will coordinate with you regarding your, the process, how to claim your prizes. Okay po? Ayan. So, ipakibalik na lang po mamaya dito sa ating secretariat. Alright? Now, to close our program this afternoon, I would like to call on our Chief Science Research Specialist of the PCHRD Research Information, Communication, and Utilization Division. For her closing remarks, we have Ms. Yulian C. Garcia.
To our panel of judges, PNHRS Research Utilization Committee Chair, Dr. Marie Carmela Lapitan, UP Manila National Institutes of Health Executive Director, Dr. Eva Cotyanco de la Paz, Department of Health, Health Policy Development and Planning Bureau Chief, Health Program Officer Mr. Pio Justin Asuncion, National Economic Development Authority Social Development Staff, Health, Nutrition and Population Division OIC Head Mr. Tomasito Habate Jr., Philippine Heart Center Management Information Systems Division Chief Dr. Pedro Sanjego Jr., our participants, our audience here in Clark, and those watching the live stream, ladies and gentlemen, good afternoon. True to its objectives, the 3-minute pitch to policymakers competition serves as an important platform as we address the need to translate our research results into policies and actions. Capacity for research translation requires researchers to be knowledgeable of the basic policy-making process and to develop the skill of effectively communicating research findings to policymakers so that they can easily understand and help increase evidence uptake. This is why, on behalf of the Department of Science and Technology, Philippine Council for Health Research and Development, I would like to congratulate the winners and all of our participants for joining us today and for taking a step towards research to policy translation, particularly through this pitching competition. Today, we heard pitches on various researches that can potentially turn into actual policies and help not only certain communities but the country. I would also like to thank our preliminary screening consultants and our judges for sharing their expertise as we try to find researchers every year who we could bring into the competition in the hopes that what they have experienced here can help and prepare them to pursue research utilization. As we continue to celebrate the 15th PNHRS week in the next few days, let us keep in mind that clear research findings are not always a passport to policy, but researchers can reframe the way health policy issues are seen, and collaboration with policymakers initially can enhance the implementation later. Again, thank you everyone for coming, and we hope to see you in the next 3-minute pitch to policymakers competition. Mabuhay po tayong lahat.
Maraming salamat po, Ma'am Yuli. And of course, we would like again to congratulate the team at PCHRD for this very successful initiative and competition. Let's give them a round of applause, the RICOD team of PCHRD. Now, before we officially end the program this afternoon, may we request everyone to please answer our evaluation form by clicking the link in the chat box in Zoom or in the comment section in Facebook Live, or by going to the URL or scanning the QR code flashed on your screens right now, okay? So for only participants who have successfully submitted their evaluation forms will be given an electronic copy of their certificate of attendance. Just a reminder po, please make sure to input your name and email address correctly. The e-certificates will be sent to your emails within 10 working days, okay? But if in case you did not receive your e-certificate within 10 working days, please send us an email with your complete name together with a proof of successful submission of the accomplished evaluation form to ccdmaili@pchrd.dost.gov.ph. Also, please be reminded that we will only accept evaluation forms until 8 a.m. tomorrow, August 11, 2022. We have now reached the end of the 3-minute pitch to policymakers competition. We congratulate all our finalists, our competitors, and we would like to thank our board of judges for their work that they have shown this afternoon. For our finalists, we hope that your excellent work will continue to transform and be translated in policies that will benefit the Filipino people in the future. Maraming salamat po to our excellent panel of judges. We thank and congratulate our team at PCHRD for successfully organizing this event. And of course, maraming salamat po to all our viewers who made it here ngayong hapon and even po sa ating virtual audience sa Facebook Live at sa Zoom. So see you again, sabi nga ni Ma'am Yuli, see you again next year in the 3-minute pitch to Policymakers competition 2023. Okay? So this has been Dr. JC Malabad from PCHRD. Take care everyone. Keep safe until we meet again. God bless you po. Maraming salamat.
Hello? Excuse me po sa lahat po ng PMP participants. Picture taking daw po kayo lahat dito. Opo. And for our panel of judges din po. Kasama po lahat ng ating participants. Okay, up next po, lahat po ng participants po muna. Then after lahat ng participants, yun na po yung pwede individual.